Hi, I'm Laura Pankowski, and I'm going to perform trach care and suctioning. So the first thing I'm going to do is I'm going to gather my equipment, then I'm going to perform hand hygiene, whether I use sanitizer or if I wash my hands. I'm going to identify my patient on their wristband. I'm going to ask for their name and date of birth. They can't speak to me, so I'm just going to have them give me a thumbs up. So then after that, I'm going to make sure, again, I have all my equipment, and I'm going to place this abdominal chuck over them. I'm also going to ensure privacy, so I'm going to close the doors, close any curtains, and I'm going to determine the need for suctioning, and then I'm going to use my stethoscope to osculate. So I'm going to move this and I'm going to listen in a zigzag pattern. After doing that, I'm going to let them know if they're in any discomfort during the procedure, to let me know, and we can stop it just by putting their hand up in a fist. So then the next thing I'm going to do is I'm going to set this to 150 millimeters of mercury, since it's an adult patient. And then I'm going to put on clean gloves. So I already performed hand hygiene. Put on clean gloves for this part. Okay, and then what I'm going to do is I'm going to move my tubing, and I want to check that the suction works. So that works. I'm going to put it in a place for myself. Ooh, there we go. And then I'm going to attach oxygen with a Christmas tree. Okay. And that's going to be to hyperventilate the patient. So right now, this is going to be what's my oxygen mask for them. So just so that you know, for the purpose of the video, I can now remove my clean gloves. I no longer need them. Perform hand hygiene. And now I'm going to put on my appropriate PPE. So I'm going to put on a mask. Even though I have this mask, it doesn't necessarily count as my mask. Okay, and then I'm going to put on goggles. We want to open up our equipment. I'm just going to toss this away. We don't want to touch the inside of this, and we want to open the saline. Now, if the saline was already opened, we'd want to lip it, so we'd want to pour a little bit out. So I'm going to open it, I pour some in, set it down, and then I'm going to don sterile gloves. Now that they're on, I can fix things. Okay. And what I want to do is I want to have this coiled up in my dominant hand, and I want to attach it to suctioning my non-dominant hand. So I'm going to have a sterile and a clean hand for this procedure, and I'm going to make sure that's coiled up correctly. Okay. And I'm going to dip it in the saline. And what I'm going to do is I'm going to remove the oxygen from the patient. So typically it would go behind them, but for this time I'm going to put it down. I want to take my, and I'm going to do this, you can do it 3 to 6 times, so I'll do it 3. 1, 2, and 3. And then I'd remove it. And now we are going to make sure it's closed, set it into a predetermined length. And then what we're going to do is on the way out, we are going to turn it and continue to oscillate. You don't want to do it any longer than 10 to 15 seconds. So then after that, I want to clean that off in the saline again. And I want to make sure that I perform hyperventilation again. 1, 2, 3. I can put oxygen back on my patient. And then you want to determine the need for more suctioning. So let's say I have to do everything again. I would just perform the same steps once more. And then in this portion, I could clean it again. I can provide oral care. So I can use this in the mouth and go to the oral pharynx. And once it's in the mouth, I can't no longer go back into the trachea. So I perform oral care. And I want to remove this from suctioning. We're going to leave this, again, still in my reach. And we're going to coil this up in my sterile glove. And we are going to remove my gloves. And we're going to dispose of that. Perform hand hygiene. And then if I did still want to perform more oral care for my patient, if they needed it, we have these little sponges, and I would put on clean gloves and do so. So the next thing that I want to do, also, I forgot to mention earlier, but when I would put the oxygen on, I want to set that to 10 to 15 liters. Okay, the next thing we're going to do is we're going to open the rest of our care. We're going to open the new cannula. We are going to dump that in to our tray. Throw this away. Again, I'm going to take saline, open that up, and pour this into this container here. I already opened my neck strip, so we have that out. We're going to, again, don sterile gloves. Okay. And then this is just to make my sterile field a little bit bigger so that I have space to work. And I can move everything over here that I'm going to be using. Okay, and then again, my hands are going to end up being one's sterile and one's clean. So what we're going to do is we're going to remove the oxygen. We're going to hold down the plate, and we're going to grasp the cannula and dispose of it. So that's disposed of. And we are going to also dispose of the gauze. I'll clean that up later. You want to hold it there. We're going to take the new cotton swabs into some saline, clean around it, garbage, saline, and we're going to go in 4s and quadrants here. Dispose of it, saline, clean, dispose of it, saline, dispose of it. We want to make sure that we insert the cannula. I actually want to do that before I clean everything. I don't know why I did it like that, but and I want to make sure that I also pat it dry. So after I do that, we want to make sure we pat everything dry, still avoiding to touch the patient with my sterile hand. Dispose of this, and we're going to take the new gauze, and this is where my hands will no longer become sterile, We are going to put that underneath the patient's neck. Okay, and now what we're going to do is we're going to change the actual collar. So we want to remove the collar, and we're going to take our new collar and we're going to position it around. I'm actually going to remove it from this side first because it's a little bit easier, and I've already had this behind the patient. And we want to make sure, if we have someone with me, they can hold it for me to make things a little bit easier.
I thought you had a package.
No, we don't get that more package. That's why we get an extra one in the lab. I think it goes in
It's fine. I'll ask.
And then we want to be able to get one finger underneath it. It's a little hard to do it with just one person. Usually I'd have somebody with me to help me, but in the event I don't, like for the video, then it would just be me doing it. Okay, and then we want to attach that as well. And like I said, you just want it to be comfortable enough that they can move their head from side to side. You can fit a finger underneath. And then I can take off my gloves, dispose of them, perform hand hygiene, and then I can place clean gloves on myself so that I can clean up everything. I want to make sure with clean gloves on that I put their oxygen back on and that I remove everything else that's in their way and lower them down and out of their semi-Fowler's position.